Okay, so today I'm testing a deep tendon reflex of the Achilles tendon, and to do this I'm going to have my patient seated with her leg just kind of hanging down. We're going to apply a little bit of dorsiflexion to it. Giving a little bit more tension will help create a little bit stronger response. And we're going to strike right above the calcaneus, or right above the insertion point on the calcaneus on the Achilles tendon here. And as you can see, she has a nice quick response there. You can also test this in prone, but since my patient is pregnant, we opted for the seated position. Next, I'll be testing wrist extensor spasticity. And what we're going to do here is we're going to tell the patient to relax and just kind of let the limb go heavy. And what we're going to do first, just kind of go through the normal range of motion at a nice controlled pace here. Feel for any sort of adverse tissue excitation as far as resistance to my movement, and then we're actually going to vary that. We're going to go a little faster and we're going to maintain that. And normally if she had some spasticity we would get some sort of resistance, but in this case we have no resistance, so she would have a 0 grade for this on the Ashworth scale. Okay, and next I'm going to be discussing the lateral corticospinal tract. And the beginning of this tract, or the upper motor neurons, are going to start all the way up here at the primary motor cortex. They're going to travel down through the internal capsule, down into the cerebral ponticle, into the anterior pons, and into the medullary pyramids, where they will actually decussate, cross over. Most fibers will cross over. They're then going to travel into the ventral horn, the lateral portion. From there, they will travel down into either the lower limbs, the distal lower limb, or the distal upper limbs, where they are responsible for kind of our fine motor movement and limb flexion. They also kind of play a big role in preventing or inhibiting antagonist muscle movement, which is pretty important for normal motion. And let's see, what else was I going to talk about here? So injuries here, or clinical presentations of damage to this. If anything happens up here in the cortex, above the decussation, we're going to see contralateral injuries or contralateral deficits. Anything happening below the decussation in the level of the spinal cord is going to present with an ipsilateral deficit. What else am I going to say? I think that's it.